Hello, still there? Okay, hello.
Yeah.
Thank you. Thank you so much for joining us today, Rita. Hello, everybody. Thank you for joining us too. Rita's about to, tell us about herself and what's going on at this really exciting conference coming up in Finland shortly. Rita, tell us who you are and what you do, please.
So I'm Reetta Kälviäinen. I'm the chair of neurology in the University of Eastern Finland, Kuopio, Finland. And then I'm also the director of the Epilepsy Center in Kuopio University Hospital. That center is also one of the members, full members of the EPICare EAN, so European Reference Network for rare and complex epilepsies. So my main research area and activity area has always been, for 40 years of my career, it has been epilepsy, all epilepsy, also those very difficult, rare, complex epilepsies. But then recently I have then started to also, during the last years, I'm also, of course, interested in general neurology and work very actively also in the European Academy of Neurology, in the epilepsy panel, scientific panel, but also in helping organizing these congresses, like now in Helsinki 25, also last year 24. I'm a member of the program committee and also a member of the communicating committee. So I'm very much enthusiastic about communicating to our stakeholders, lay people, public, about what we do.
Thank you, because I think the old-fashioned way of looking at epilepsy was very top-heavy. The communication only went on between doctors and not even nurses sometimes, and the occasional scientist. But what's great about you is you see the value of actually communicating with, as you say, lay people, and I think you can have greater impact on improving quality of life if you speak to the people who need the help, right?
I've always been taught, and I've always been myself thinking that I think there are no secrets. We should be very transparent. We should communicate everything that we start to know, what we think or we discuss. That should be sort of immediately communicated to at least to our patients and their caregivers, but even to the public at the same time. And decision makers, of course. We cannot say that we don't have the resources if we don't communicate it very clearly what we need.
Exactly. I don't think you can say we can communicate just a little bit of what one is doing and then say, oh, by the way, we need more money to do what we're doing, right? Because
Yeah,
nobody will, they'll say, well, what? You're not doing anything anyway. So why should we fund this?
yeah, absolutely.
Yeah. So tell us about the EAN Congress in Helsinki coming up. So Saturday the 21st to Tuesday the 24th. What's going to be going on?
So EAN Congress, so European Academy of Neurology Congress, is basically mostly the main target group is neurologists, so adult neurologists. But of course, the aim is to also bring together all the people, experts, researchers, also clinicians interested in neurological fields, and also research. And then, of course, we have industry of the field supporting us and telling us what they have, what new they have to offer, and then we try to collaborate with them. And we give prizes to different very sort of lifetime achievement awards to colleagues that have really done enormous work in our field and listen their lifetime lectures, but also we of course promote young researchers, young clinical neurologists and people in the field. We also have a what I'm involved at the moment. We have a clinical round session where we bring patients and then really try to solve the cases that are presented there with colleagues, but also so that the patient can tell their own view of the symptoms, and then another expert tries to solve the case publicly. This is also to promote the work that we are doing. But then at this particular Congress, the overarching theme is neurology within the society. So we go back to the public engagement, and so that neurology is not an isolated island, but we really need to work really to achieve results. We need to work within the society. We need to promote brain health, but we need to also work within the society. And therefore we have, for example, these television broadcasts, which you are also going to be involved. And so every morning there's this kind of TV session which is broadcasted live from the Congress Center. It can be seen publicly from the website, and the couple of people then tell what is going to happen on that day in the Congress. But then there are several TV sessions, and these TV sessions after this morning show, they will then have particular topics like history, or climate change and neurology. But then mostly these will be related to society, how we promote brain health, but also the problems like where you are going to be, Torie, you are going to be discussing about, do we still have stigma in epilepsy? I'm going to be in a session where we really look at very tough question, were looked through the lens of diversity, equity, and inclusion in addressing healthcare, and in this case neurological care, whether there's equal access to care. And then there's of course going to be also other very tough questions like migration and that sort of thing. So I'm really happy about these discussions that are going to go through. But overall, we are talking about more brain health than brain disease only.
That's so good. So it's kind of we're going to be looking at it from the most positive perspective possible. So how can we promote brain health? And that is, so you might have a disorder already, but how can we improve your health and your quality of life? And I guess also prevention where possible too. Is that right?
Absolutely. More and more we are seeing that, for example, perhaps 40% of the dementia, even Alzheimer's disease, for example, could be prevented by lifestyle changes.
Wow.
So there's really research about this, and that's very important that we really tell this to the public, because if we keep it ourselves, what does it then benefit? So we really need to do this kind of preventive research of our diseases, but then we need to immediately also let the public know about our results.
Amazing. That is an amazing number, you know.
It's an amazing number, but you didn't know it.
What, right? Or I might have forgotten it, to be honest. So I forget a lot. But 40%, and you think, sorry, I'm digressing a bit, but like we talk a lot about obesity, we talk a lot about cardiovascular disease, and how, for instance, obesity can contribute significantly to that. And we say, okay, try and eat a healthy diet, and we're trying to get the message from that, you know, we should be looking in the same way at neurological diseases like Alzheimer's. And loads of people with Alzheimer's develop epilepsy too. So just thinking about it, we could prevent lots of epilepsy cases as well. Amazing. Yeah.
So, and that's also very important, that we shouldn't anymore just have epilepsy doctors meetings and Parkinson's doctors meetings and MS doctors meetings, but we should gather together and talk about brain diseases, brain health, because they have these interactions together.
No, totally. It's a bit like metabolic health as well, for instance. That comes into thing, right? So can you excuse my ignorance here, what's the difference between our public brain health day and also World Brain Day? What's the difference?
Well, World brain day is at a certain day during the summer, next summer again, and it's not related to the Congress of the
Okay.
World Brain Organization. So what we are now doing for the first time in Finland, in Helsinki, and which I'm really proud of and happy about, is that the Congress is also really opening to the public for a couple of hours, not the whole day. But on Monday, 23rd, 5 o'clock, we open the Congress for those that have been pre-registered for this event, and then we hope that those patients that come to our event, they take us, whoever is interested, also the professionals that are not attending the Congress per se can come, and this is free. So it doesn't cost anything. Of course, it costs something, but we are offering it free, of course, for those who attend. And then there are going to be experts from the Congress. This time it's going to be migraine, memory disorders, movement disorders, couple of topics that we are going to tackle more in a discussion that I'm going to moderate. It's going to be translated into Finnish for those parts that are going to be in English, but there are going to be also Finnish-speaking experts, part of them. So mostly I try to make it in Finnish language, and then somebody else can take care of the translating, because now we hope that the people really from Finland would come there at site. And then we are going to have also a live stream that, for example, people from Europe,
Like this?
like this could join. So it's quite challenging couple of hours. So we have discussions, but also then on site we have a reception, networking reception afterwards, where you can really meet people. It's now when we think about it, it's really amazing that we haven't done this before. So we have had our Congress, but we have not invited anyone else to join us ever. So
What's that about?
this is a little bit opening up in a new way, which is what we should do, really to discuss about what patients and caretakers, family members, and everybody could do for their brain health. And so it's not so medical thing. It's really what you can also do yourself, and also the preventive measures for brain health.
Well, I personally think part of medicine is communicating though with the public, isn't it? It's like, what's the point in us doing stuff behind the scenes if the public don't know about it? So I think this is wonderful. It's so good. So tell us about legacy work. So have you done any other brain health missions? How does it relate to what we've just spoken of?
Yeah. So brain health mission is activity of European Academy of Neurology, where they have really got collaboration with all the possible organizations that do this kind of work. But now then, what we have also in Finland now, before this Congress and the Congress that we had last summer, it just happened that the proper Congress in Helsinki was last summer, and then but there were some issues why we are again having the Congress in Helsinki. But then
promote Finland.
it makes us possible to really pilot this kind of legacy activities, because perhaps it's true that our society is more ready for this kind of work, I would say, than many other countries. So and we are small and we all work together very well. So but the legacy work we have been doing, for example, a very important new opening with EAN last year and now again this year, and that's a school challenge. So we have gone to all schools in Finland, and we have tried to get them, the teachers in their classes, to make any kind of activity and to compete with the results. So with a video or poster or song or T-shirts with statements or whatever that would promote brain health, these preventive measures, lifestyle changes to promote brain health and prevent brain diseases. Because this should be not started when you start to be demented, but this of course should be
Ideally, yeah, earlier would be great.
early, and this should be a sort of mindset in your life, and not so. And this and it's not, of course, only the competition or the challenge what is important, but we would like to have this in the schools as the content of the curriculum. So I think gradually this is happening. And for that, EAN has also created a so-called brain bubble, where you have all the material in a one image. You have a brain, and there are different kind of items how to really plan and protect and preserve your brain. It's quite clever drawing, and it has been now translated to 28 languages. It can be downloaded from the EAN website, and I've noticed that in the school it already helps the teachers to start to teach these topics a very simple way. But this is part of the brain health legacy work that we have been doing, and this is doable in all the countries. We have now the SOP for this sort of operating procedures for this, which can be copied in other countries. And last thing that I would like to mention is that another legacy work has been participating to a women's fun run, where we have had a tent, again brain health tent, where we have also given advice and having fun. But that's probably then a little bit already speaking to people who already know what to do. So especially we should in future aim towards those people who don't know, and who so that's the target in the future.
Fabulous. Oh, it's so exciting. Okay, well, I think our talk should hopefully interest everybody, because it's yes, to clinicians, to researchers, but also to lay people. And even I think mums and dads who are interested in, who might not yet be affected by any neurological disease, but want to prevent it in their children and themselves. So yeah, no, this is fabulous. All right, well, everybody, I will provide links to what has been discussed underneath this. Give me 5-10 minutes and I'll put them all underneath. And also this will feature on the website, so and you can check out more about Reetta on there. And please do join us in Helsinki. I think it's going to be a real laugh. And if you are too far away, know that, as Reetta has said, that we can that you can tune in remotely. So fab stuff. Thank you so much, Reetta.
Okay, thank you.